You know, the old saying, the foot bone is connected to the knee bone is connected to the leg bone, is very much true. The mouth is connected to everything else in your whole system. When you think about it, is your interaction with the world, short of vision and touch, is many times oral or nasal. Is that, you know, the air you breathe is coming in through one spot, nose. Everything you eat comes through one spot in your mouth. And as our society is changing, certainly the quality of the foods that we're getting is changing. It's not as pure as it was several generations ago, where we grew everything and we knew about it. So all of those chemicals and impurities, antibiotics that they're putting into livestock and poultry to make them grow faster and quicker, many things, chemicals and items that our bodies really weren't designed to process, are starting out in your mouth and getting absorbed in the mouth tissues, and then from there on into the digestive system. So there's a huge connection between what's going on with your mouth and every other portion of your body. I have a college friend, Seth, who's now is a heart and lung surgeon out in Michigan. And I talk with Seth you know, periodically, but it's interesting to me to note that when he talks to patients that are having heart problems, the number one question is, tell me about your family. And number two question is, do you go to a dentist and are you in good dental health? Because they know the connection between these inflammation going in the mouth and what's going on in the heart. If you're noticing that your gums are bleeding, teeth are getting loose, sometimes even people will say, I see some yellowish stuff around my teeth, is that a concern? It's a concern in more ways than you could probably even imagine. From a dentist standpoint, we know that those are signs of a breakdown of your body actually attacking the gums and bone in your mouth through it's called an inflammatory process, and that can cause the bone to melt away, and ultimately that's what holds your teeth in. If you're noticing any of those things, really the first step is go to your dentist and have a really thorough evaluation of, so what is the level of health of my gums? What's the level of health of the bone? Is there this infection / inflammation going on in my mouth which could be affecting other systems? And then develop a plan to attack that. And once that's treated, and the good news is we can treat that, once that process is eliminated from your mouth, then the other organs and systems in your body are protected and they're fine.